was introduced to this baby actually while he was a fetus, still in his mother. We surmised that this baby indeed had one of the more complex syndromes that can occur in any child. It's called the EOIS syndrome, which is an extrophy, which means that all of the intestines and the bladder are on the outside.
العمليات هذه احنا عادة نعملها على مراحل. الحالة سويناها احنا من تقريبا 10 شهور حق محمد. المرحلة الأولى اللي هي مجرد تسكير جدار البطن، وفي نفس الوقت استخراج القولون، لأن محمد طبعا بسبب التشوه اللي عنده ما عنده فتحة خروج، فمعتمد على فتحة القولون.
Normally these two pieces are put right together, and the bladder and all of the urinary tract is fully formed. Unfortunately, he was born with a condition where his bladder and everything was open to the air, and his abdominal wall also was not fully formed. In addition, he had a spina bifida on the back, and you see how open his spinal canal is, here. And so that had to be repaired almost at birth by one of our neurosurgeons, Dr. Khalid Al-Kharazi and his team.
The baby was born a little early, so that we had to scramble our team early. And then we performed essentially heroic measures in order to save the baby's life. And then, because everything was on the outside, we needed to make a decision as to what needed to get done in order for the baby to continue to live. So we went to the operating room, and the first procedure, which is not this one, this is within the first days of life, was essentially to close the intestines because they were open. That's part of the cloacal extrophy. And so we ended up closing that. We made a stoma, which is a bag just on the side, so that whatever the baby eats can go out the side. And the bladder remained open, and we had to close the entire abdomen with a mesh, kind of like parachute material, in order that things don't remain on the outside. And at the same time, Dr. Jason Howard, who's the pediatric orthopedic surgeon from Sidra as well, he performed these staged procedures where the legs were bowed on the outside, and he put these casts and basically put the baby back together as far as the legs were concerned. And at the same time, you needed nutrition so that the baby can heal. You needed the baby to continue to develop. And we really struggled with that because of the baby's intestines. We went through a long period of time of trying with the parents, and the parents are fantastic. We would say, let's try these feeds, and sometimes they'd work, sometimes they wouldn't. Baby eventually couldn't eat enough, so we had to put a tube down. And then there was some reflux. Some of the food came back up, so we weren't providing enough nutrition for the baby to really heal all of this. So then we put a special kind of tube in order to do that. And I mean, it's a part of all of the things that are going on with the baby, of how complex they are.
The second stage of the surgery that Dr. Bibi started. It will be for the bladder X-ray, and I think all the team will cooperate together. Dr. Jason will make some things for the bone. Dr. Bibi Sali will manage the bladder X-ray. Dr. Abdullah will make hernia and something for the esophagus. It will be a big surgery.
For me, myself, for sure, I'm just a little bit worried, but inshallah, with the doctors, everything will be okay, inshallah.
We were admitted here for 3 days now. Doctors told me that it may be about 16 hours.
Today, we are going to do the second stage of a very complex surgery for a patient with cloacal malformation or cloacal extrophy, which is the most severe anomaly that we have in pediatric urology, because it involves not only the urinary system and the bladder, but also the intestine and the bones. So we're going to have a teamwork today based on not only urology, that is the main component for the bladder, but we need an orthopedic surgeon to close the bones, as they probably explained to you, and the general surgeon is going to help us to refashion everything, the big hernia that the baby has in the abdomen.
Today what we're going to do is close the bladder, reconstruct the bladder and also the abdominal wall. The way that we do that is actually to take the tension off the anterior soft tissues and then to let Dr. Pipi Sala and the team, as well as Dr. Mansour Ali and Dr. David Sigalet and the general surgery team, to perform all the visceral work and the abdominal work. So where we're going to make the cuts actually is from right here and right here. And then we rotate this side and this side together like closing a book. When we close the book, we put some pins in the bone here, here, and here, and here. And we use an external fixation device to hold the pieces together while the bone heals over about 4 to 6 weeks. And the reason why we do that is so that we can decrease the tension on the anterior soft tissues so that the bladder and the abdominal wall can be reconstructed in a tension-free manner.
You know, the best part about this, I mean, I had trained in an environment where we literally had everything available to us with every expertise. So right now, you know, we're in an environment where not everything that we want is readily available. We have to gather up all the expertise together. And I would say that before this case, 99% of expert physicians would say that this baby would not live, and maybe even shouldn't live, in a sense of, should we even try or should we just do comfort care? Because that's a reasonable option for some parents. And the best part about this is that should you gather all of the appropriate people together, and it's a full team, it's an enterprise more so than just a procedure. But if you get all the right people together, you plan things accordingly, they're well-trained, well-intentioned, along with the parents that know what they're getting themselves into. Should you do all that together, then you can have an outcome where a baby is really doing well. And at the same time, it really sends a message to folks both in this country and in the region. Stuff like this can be successful.
We just finished the first stage of our reconstruction of this cloacal exstrophy case. My part was to cut the pelvic bones and derotate them to bring them to the midline so that the soft tissues in the front get a little bit less tense, so that Dr. Pipi Sala, Dr. Abdul Rahman Al-Qadi, Dr. Mansour Ali can bring things together and do their reconstruction in a tension-free manner. Our part of the case was actually, it was a little bit difficult. The boy is quite small. His pelvis is only really about this size, okay, and very, very thin and splayed open like an open book. So what we had to do was work on both sides of the bone, on the front and the back, and then get down into the notch behind the pelvic bone itself. It's a very tight little area. There's some big blood vessels and big nerves there, so there's some important stuff that we have to protect and avoid any injury to. And then we actually use a saw and cut the bone right through so that we can twist it and derotate it to the center. We did that the same on both sides, and thankfully we had absolutely no problems. We did have a little bit of blood loss, but nothing out of the ordinary, and certainly what we expected. And the boy tolerated it very well. So on to the next phase, which is the bladder reconstruction, and then following that will be the abdominal wall reconstruction.
Sometimes the parents, they don't really remember what you did as far as the injection that you gave or the cut that you made or the kind of suture. What they really remember is how you made them feel. And that is actually the single most important thing, along with providing the standard medical advice that you're going to give.
A lot of people who are caring with Muhammad, Dr. Jason Howard, Dr. Abdullah Zarouk, Dr. Khalid, Dr. Pipi Sali for sure. I don't need just to forget any one of those, but all are giving the best care I think they have.
This is one of the cases that will help us to eventually show that we have conditions in Doha now to perhaps build a center of excellence for pediatric urology, because if we do a case like that, which is the most complex one, and hopefully we'll succeed, we'll be able to perhaps establish a center for treatment of these complex anomalies.
من خلال سيدرا وعلى راسهم طبعا سمو الشيخة موزة، ان شاء الله باذن الله نحط ان شاء الله قطرة على الخريطة في جراحة الاطفال ان شاء الله.